Often we'll get clients coming in here who've been at a physical therapy clinic where they've been thrown on a bicycle, then they get the hot pack, then they do a few linear exercises, even though most of our movements aren't linear, and then they get ice pack at the end, and then they're sent home with a few exercises. And this is a very kind of old-fashioned, traditional approach that doesn't often work. Physical therapy at Elements is very unique. We have one-on-one for an hour with your physical therapist. And the physical therapists here have a combination of manual, hands-on skills as well as the therapeutic skills. We all have at least 10 years experience in the field. We teach you about your body and how you manage your body and your injuries so you don't re-injure, which happens a lot. And another unique aspect is we use the gyrotonic method and Pilates in the rehabilitation process. We have clients coming in who use all the modalities. For example, a woman in her 30s who sits at a desk all day long. She sustained a back injury when stepping off a bus, and she comes to the gyrotonic method for her flexibility and her strength training. She also uses Pilates for her core work, and then she sees one of our body workers to realign her pelvis. And between the three systems, she's back up at work and paddleboarding on the Potomac River. So we look at the whole body, and we're able to reassess different movement patterns so that everything goes smoothly and works efficiently. We have pre- and post-op patients, so we've had people with knee replacements and shoulder repairs come in and we restructure their bodies. We have Bill, who's almost 90, right. So he was in World War II, and he had sustained injuries, shrapnel in his arm, and he's had a knee injury. We work with him. He's now walking further than he's ever walked before. He's more flexible than he was. He had a back injury, and he now knows how to manage that back injury. So even though he's approaching 90, he is now moving younger than he has in the past. We have a college student, very avid soccer player, and he came because he also hurt his knee. He has very loose ligaments and tight muscles. So we can use that to strengthen his knee in a way that will help him play soccer. Through physical therapy at Elements, we get people back into paddleboarding, tango dancing, skiing, whatever they love and enjoy.